A man won an eating competition. This is how he destroyed his knee. Hey guys, it's Dr. Derek here with an absolutely insane tale of a man completely damaging his knee joint simply from winning an eating competition. Let's dive straight in. Let's call our patient Sam. Sam entered the annual food competition fully confident of winning the whole thing. Sam's eyes locked onto the competition's grand prize, a year's supply of fiery curries. As a broke college student tired of ramen, this was his ticket to a flavor-packed escape. Now the competition began and Sam faced a clock ticking down. The challenge was to devour spoonfuls of increasingly scorching curries in record time. Sweat dripped from Sam's forehead as he tackled curry after curry, the heat escalating with each bite. The final spoonful approached and Sam had the worst pain in his stomach. His stomach was gurgling, but he pushed through and he reached his goal. He won the whole competition. As he headed home, his stomach pain got even more intense. On reaching his doorstep, he urgently rushed to the toilet and ended up spending the whole night there with non-stop vomiting and diarrhea. He woke up the next morning still with some diarrhea, but also he had a red left eye. But because this eye wasn't really causing much pain, he didn't think much of it. A week after the episode, something happened that took him completely by surprise. He woke up one morning with the most excruciating pain affecting his left knee. The knee was swollen, hot and red. He couldn't bear any weight on this knee. Now he was due to pick up his first of the 3 annual supplies of curry from the restaurant, but try as he might, he just couldn't leave the bed. He hobbled towards the door and the pain of his knee was so bad that he collapsed onto the floor, screaming out in so much pain that his housemates came to find him. It was at this stage that they called an emergency ambulance. The doctors immediately assessed him and saw his swollen knee. They also did his observations, which were all normal, including his temperature and his pulse. They tried to ask him some questions to gather some more information about his symptoms, but because he was struggling with the pain, he wasn't really able to answer them. The most that they could get from him was that he had not had any recent falls, making it unlikely that he'd broken a bone. An x-ray was also arranged, which didn't show any signs of a fracture. Now, the swelling of his knee and his inability to weight bear could be something even more sinister. What if he had somehow developed a severe infection of his knee joint? Now the doctors decided to take some bloods and his inflammatory markers came back raised. The doctors were convinced that his symptoms were due to an infection, so they put him on some antibiotics and decided to obtain a sample of the fluid from his knee by inserting a needle into his knee and sending off this sample to the labs. The result came back and unfortunately this still showed no cause of his symptoms because no infection was present of that knee. You see, there was no bacteria found in the fluid within his knee joint. Now, other investigations to look for arthritis, such as rheumatoid factor blood tests, ruled out the presence of an inflammatory arthritis. So completely confused as to why none of the usual tests showed a cause of his symptoms, the doctors decided to revisit the history of this patient. Now at this point his pain had improved, so he was finally able to give the doctors more information about his medical history. And it was at this point that the diagnosis was reached. Can you guess what it is? Well, Sam told the doctors how just a week before he had suffered from a very severe bout of food poisoning, and that following this he had this really severe pain affecting his left knee, and also he had some redness in his left eye. Now with this history in mind and all the other negative tests and also the presence of symptoms such as the knee pain and the red eye, it was clear that the cause of this patient's symptoms was a condition known as reactive arthritis. Now reactive arthritis is a rare type of arthritis in which you develop inflammation in the joints after you've had an infection in some other part of the body. This is typically either an infection such as a tummy bug, or it could be also a sexually transmitted infection. Now, in this condition, the body's immune system seems to overreact to the infection and it starts attacking the healthy tissue. And this causes it to become inflamed, as we can see in our case of Sam. Now, in most cases, the symptoms last for around 3 to 6 months, and then they completely go away without having any long-term impact. Patients usually respond well to our non-steroidal anti-inflammatory medications. An example of this is something like naproxen. I hope you enjoyed today's story, in which we've taken a look at reactive arthritis and how things such as food poisoning can trigger it. As always, if you found today's video helpful, please leave a like and subscribe, and please leave a comment. How quickly did it take you to reach the actual diagnosis? I'll be really interested to find out how easy or how hard you found this case discussion. As always, I truly care about your health and I wish you the very best.